We are so excited to roll out the first 19 cars of our company car fleet for North Mississippi Medical Center Home Health and Hospice staff. We will have a total of 161. It's an excellent opportunity for both home health in regard to expense management, but it's also a great benefit for our employees.
Well, I start out first thing in the morning around 7:30 looking at my schedule, and then I hit the road and start seeing my patients.
Well, a typical day for me at home care starts, of course, at home. I'm pulling up my patient's charts, going through my email, and then I just start from there and head out and see people until I get done, just from one patient to another.
We help the patient with their bath, do shampoo, hair care, skin care, oil care, nail care, skin care, dressing, tidy up their rooms, make their beds.
Social workers in home health care are going to visit patients to mainly help their families and the patients deal with life-changing diagnosis and where do I go from here, and now how am I going to take care of my family member now that they're sick, and helping link them up with community resources and things. So
I work on everything from memory to swallowing to word finding, to the aphasias, the apraxias, dysarthria, slurred speech, voice, a lot of memory and comprehension with our patients. Safety in the home is a large thing we do, especially medication safety. Are you taking your medications on time? Swallowing is something that I've focused on for several years. Making sure the diet consistencies are correct, that they're following all the swallow precautions, that they're also using they're doing their appropriate exercise program to strengthen the muscles to have as safe of a swallow as they possibly can. Prevent pneumonias and be able to stay in the home environment as long as they can. Well, as an LPTA, what I do, of course, the PTs, they come in and do the evaluation visits and do the discharges and the research and the functional assessments, but I actually come in and do like the plan of care. Like I go in and I do the exercises and the walking with them, check their vital signs, check their pain, their falls. I've actually just come in and implement the plan of care, I guess is the best way to put it.
Currently, we reimburse their expenses 1 month later. Our staff travel over 2.5 million miles a year. This way, they are driving a brand new car. It has all the latest safety features. It has, they'll be issued a fuel card. All of the maintenance is covered. The expense of operating the vehicle is totally upfront managed by North Mississippi Medical Center.
I think if they see us drive up, they'll know, it's us coming, not a stranger.
They'll see that we are a servant. We're somebody there to help, and hopefully it will mean an extra measure of safety.
Our staff are on call 24 hours a day, 7 days a week, to take care of our patients, and if they have a safety issue, if their vehicle breaks down, then they do have roadside assistance. And then also there is an app where if we have not heard from them, then we can locate their vehicle. So that's a safety feature for them as well.
I have been one of those nurses that have been on the side of the road with the transmission that has gone out, flat tires, anything that could possibly happen to a vehicle. It has happened to me in the middle of the day, in the middle of nowhere. And sometimes in some of the areas that we go, the cell phone service may not even work as well. So I'm excited because I know that I'm going to have that security with, if something happens, then I can call someone. My husband, on the other hand, is also excited because it's going to be something he's not going to have to keep up with anymore.
That is one of the most important features. Our staff are taking care of patients in their communities, in the communities they live. Our visibility will be as far north as Alcorn County, Tishomingo County, as far south as Webster County. Our western border is Lafayette County, and then all the way to the Alabama County line. So we'll be able to just let the world know that we are out there in Northeast Mississippi.
It's just a symbol of pride for me because I've worked for the medical center almost 30 years now, and this is just one of the many things that we have done to help improve the care of our community.